This week, Mayor Michelle Wu announced that she's expecting a baby girl, but she also took the opportunity to open up about suffering 2 miscarriages before she became pregnant.
And joining us tonight is Dr. Michelle de Blasi, a psychiatrist at Tufts Medical Center. Doctor, it's always great to see you. So it is, the first question is, it's not an unusual thing for women to go through this, obviously, but it's still not something that many like to talk about. Many do struggle talking about it. How important is it that when a high-profile person like this, a public figure like the mayor of the city of Boston, the largest city in New England, figures that she can share this kind of experience?
You know, I think it's really helpful when public figures like this are comfortable sharing with us some of the personal challenges that they're going through. You know, especially with miscarriages and infertility issues, a lot of women are really embarrassed or scared to talk about it. And so they're suffering through this in silence. And so when public figures like this start to talk about it, it really destigmatizes it, and it helps people to start, maybe sharing on their own and feeling more comfortable and more hopeful.
So you just said that there's stigma attached to these issues. How do you talk to your patients about working through this?
Yeah, I think, like you said, there really is a big stigma around infertility issues. I tell my patients that the one thing you can control is what information you share with people and to which people you share that with. You certainly can't control what people's responses are going to be, or if they're going to be responding in a stigmatizing way. But the best thing you can do is to really do your own research on, infertility, about the stigmas around it. And so when people respond in a stigmatizing way, you have a way to actually guide them and sort of correct their misperceptions.
Dr. de Blasi, we obviously and importantly, we focus on women a lot of time when you talk about miscarriages, for the obvious reasons. But how can men be part of this? Can men be part of the solution when it comes to recovering from this kind of an experience?
Yeah, I think a lot of times men in this situation actually feel really helpless. I mean, they're watching their partners go through such emotional and physical suffering, and they really don't know how they can fix it or make it better. So I really encourage men to just remind them that they can be helpful just by being there for their partner, being a listening ear, showing them support, and that can be helpful in the healing process together. But certainly men can have their own feelings about this, right? Mm-hmm. They can feel hopeless about their fertility issues, or feel totally helpless in the situation. So if they're really struggling themselves, they should try to seek out help, talking to a friend, a therapist, or even a support group if they're having a really hard time.
Great advice, great reminders, Dr. de Blasi. Thank you so much. Stay well, doctor.